Hello, everyone. I'm Ulrich Sidney, the president of the Association of Future African Neurosurgeons. And this weekend, today, we're going to have a very fantastic speaker. So before we introduce our speaker, I want to just a short story about how I came to know Dr. Alalade. So I was introduced. I learned about Dr. Alalade following on some news information from the UK about how he was this fantastic person as a surgeon who was helping folks back in the UK to, make it as a mentor. He was helping them to make it in different aspects of life, especially medicine. And I happened to reach out to Dr. Alalade, and since that time, he's been exceptional. He tries to make the time to be available, and as you can see, he's made the time today to speak to the younger folks on our continent who are interested in neurosurgery. So we are honored about this. Obviously, we're going to have a more formal introduction, but I wanted to say this. So we have, as we always do, we like to have everyone introduce themselves before we go on to the speaker. So the first person on my list here is Dr. Aminata. Please unmute your mic and introduce yourself.
It's an honor to be here, and I'm eagerly anticipating the presentation. I'm Aminata Sala, third-year neurosurgery resident training in Zimbabwe.
Thank you, Dr. Aminata. Next up is Crescentia Mashari.
Hi, my name is Crescentia. I'm a medical student in Russia, 5th year. Thank you.
Thank you, Crescentia. Then David Dale.
Hi everyone, I'm David Dali. I am a medical student in Russia and first year.
Okay. Nice to have you. Darwin Sichimba. Darwin, are you available? Maybe not. If you're speaking, you're muted, Darwin. Hello, Darwin. Okay. Next up, Ndali Genevieve.
Good evening, everyone. My name is Ndali Genevieve, 4th year medical student, member of communication operation of AFAN. Thank you.
Ndali, where are you from, please?
From Cameroon.
Thank you. Gideon.
Hi all, my name is Gideon. I'm a 4th year medical student in London. Happy to be here as always.
As always. Thank you, Gideon. Thank you for always being around. Dr. Igor Nietzsche. Dr. Nietzsche, if you're available, please unmute your mic. Yes.
Hello, my name is Igor Nietzsche. I'm from Cameroon and do my residency in Ivory Coast. I'm happy to be here.
Thank you, Dr. Nietzsche. Lorenzo Sebopelo.
Hello, everyone. My name is Lorenzo Sebopelo. I'm a second-year medical student in the University of Botswana. Thank you for having me.
Well, thank you, Lorraine. Thank you. Enoch Lampthe. Enoch? Okay.
Hello.
Hello?
Hello.
Yes, can you introduce yourself, please?
Okay, I'm in the country. I'm a 4th year medical student in Ghana.
In Ghana, okay. Nice to have you.
Thank you.
Yes, and we have Dr. Natalie Ngomsi. Please introduce yourself.
Hello everyone, I am Natalie Gomsi. I'm a PG11 and neurosurgery resident, and I'm also the Secretary General of AFAN. Nice to meet you, and I'm really eager to follow your presentation, Dr. Alalade.
Sorry, Dr. Natalie, your residency program?
I'm PGY1 Neurosurgery Residency Program in Abidjan, Ivory Coast.
Okay, thank you. The next person on the list is Dr. Marvin Sopmene.
Yeah, hi everyone. I'm Marvin Sopmene from Cameroon. I'm actually year 1 neurosurgery resident in Ivory Coast. I'm pleased to be with you. Thank you.
Thank you very much. Wapre Senyoy.
Hello everyone, I am Wapres, fourth year medical student from University of Buea, Cameroon, and I'm a member of the communication and operations team at AFAN. Thank you.
Thank you very much. Dr. Franklin Tetuno. Dr. Franklin, can you present yourself, please? Okay, not around. So we'll go ahead and present our guest today. So our guest today is Dr. Andrew Alalade. He's a consultant neurosurgeon from the United Kingdom. So it's customary to say Mr. Andrew Alalade because he's a consultant. So Mr. Alalade graduated from the University of Ibadan, and then he went on to do his residency training in the United Kingdom at the London North Thames Rotations program. Then following his residency program, he went to Queen Square, London in 2016, and then gained a BASO HCA International Foundation traveling fellowship that he did at Weill Cornell Medical College, that's in New York, USA. And he did an advanced subspecialty fellowship at the Princess Alexandra Hospital in Brisbane, Australia, as well as at the Walton Centre in Liverpool. He is a fellow of the Royal College of Surgeons in England and the European Board of Neurosurgical Societies. He's an author of multiple books, book chapters, peer-reviewed publications. He's a college tutor for the Royal College of Surgeons England, and he won the Black British Business STEM Award in 2017. Thank you for being here today, Dr. Alalade.
Thank you very much, Ulrich. As you were reading that, I was wondering, I was like, who's this guy he's describing? The main thing anyway is as Ulrich was talking about all that stuff, the main aim about this is to make sure that everybody here pretty much achieves much more than that. That's the main objective. And for me, it's about making the job easier for people who are coming in the next generation. It's quite tough, and I was listening to some of your previous talks, the AFAN YouTube talks, just before this, just to listen to what people have said, and people have described neurosurgery trainings in different countries. And I think, you know, one thing that was common with what most people said was how challenging it could be. And that's the truth. But sometimes when you have people like yourself, when you have people with similar stories, similar journeys, it gets easier. And that's my main objective. So when I was chatting with Ulrich earlier, that was the main intention, is to make sure that everybody here, and I've seen quite a couple of names that I know and people I've seen on Twitter. Gideon I know quite well. Aminata, I've just sent a LinkedIn request. So for other people, if you get a LinkedIn request from me, please link up and connect. So we're going to talk about preparing for a career in neurosurgery, and it's going to have a bit of a UK bias, so you're going to have to forgive me for that. But I know that there's a lot of overlap with the different countries. Neurosurgery is very different in different countries, but a lot of it is common and the same. Can I share my screen? Is that okay?
Yes, please.
Yeah, can I? Okay, cool. I think you have to give me permission, Ulrich, to share.
Yes, sorry. Let me just get that real quick.
So it should be a bit of an interactive session. Don't just allow me to talk all through. Just feel free to ask me questions at any point, at least based on the moderator's permission.
Yes, it's possible now, Dr. Alalade.
Okay. So I would. Let's see. Can you see?
No, not yet.
Not yet? Okay.
Not yet. Yes, great.
So like I said, feel free to ask me questions at any point. So thanks, AFAN. I was really excited when I heard about AFAN. It was just God sent. I just thought it was pretty much the best thing that could happen to African neurosurgery. So I'm quite happy to give this talk here. What's neurosurgery? We all know what neurosurgery is all about: the brain, the spine, peripheral nerves. If you look at the distribution of neurosurgeons per capita worldwide, and this is something I've kept for a couple of months that I found on the internet, you'd find out that neurosurgeons are still not enough all over the world. So you have countries like Russia, you've got Bolivia, you've got Japan. Japan has got the highest concentration of neurosurgeons. So they're the only ones who are green. They're the only ones who are 60 per 1 million. That's Japan. But everywhere else, even the UK is somewhere here. The UK doesn't have enough neurosurgeons. You've got the US of A here, with Canada in between. Canada have not got enough neurosurgeons. And then we've got our home country, Africa. So we're still running low on neurosurgeons, and that's our main objective, is to try and increase these numbers and contribute to minimizing the neurosurgical associated morbidity and mortality all over the world. Now, this was me. So I went to medical school in Nigeria. This was me. I was pretty much a class leader. This was sometime around 2002, 2003. But I came across this journal, and this journal was one of the main things that just inspired me and gave me a lot of inspiration. I've got to people who know me, there's several reasons why I decided to do neurosurgery. But coming across this journal at a time where there wasn't Twitter, there wasn't good access to journals, this just blew my mind. So it was about the Black African neurosurgeons practicing on the African continent, and I counted the numbers at the time. It was written by a gentleman called Adeloye, who was the second neurosurgeon in Nigeria, I think. And he spoke about all the Black African neurosurgeons practicing on the continent. He talked about Odeku, who was an American-trained neurosurgeon. He was the first Nigerian neurosurgeon. I worked under this gentleman, so this is the prof, very senior professor in UCH at the time in Ibadan, Professor Shokumbi. There were about 37 names in this paper. This is Kalangu, who we know so well from Zimbabwe, and this is Maria Kuto from Mozambique. So I was just quite impressed that these people were able to brave the odds and be neurosurgeons, because looking through all the surgical leaders, all the surgical tutors, there weren't many of them. But when I read this journal and heard about these people, I was quite delighted, and it was one of the things that inspired me a lot more to at least join this number. So how did I start about doing this? I knew from speaking to people and finding out from people that I had to engage in some form of shadowing programs, learn from people. I had to volunteer, and at that time I wasn't really aware of this. But nowadays, from assessing people coming into the neurosurgery training program, from seeing how people are graded, how people are assessed, I found out that these are very important things, particularly in the UK system, but it's applicable everywhere. Now, this is something that the UK tends to use, and they got this from CanMeds. So CanMeds is it's called the CanMeds framework, and it's from Canada. And what it shows is that the 21st century doctor or 21st century surgeon should be able to demonstrate all these skills on their CV. So you must be able to show that you're professional, you're a scholar, you're a health advocate, you're a manager, you're a collaborator, which is why we're all here, because we're collaborators with AFAN, and you're a communicator. So your CV at first glance should be able to show this. A few years down the line, the UK also took this and incorporated that into something called the Generic Professional Capabilities Framework. So you literally get assessed to see how well you demonstrate this from your medical career. A bit of a summary here. So in the US, there are about 3,500 practicing board-certified neurosurgeons and about 100 approved training programs. Every year, just short of 200 training positions open. The UK is slightly different. We're a very small country. The CIA website describes the UK as just being, the same size of the state of Oregon, which is one of the smallest states in the US. So there are just about 400 neurosurgeons. We've got about 33 neurosurgery units, and every year it's just 10 to 30 training positions that open. Overall, when you look at the whole of surgery, neurosurgery constitutes 3% of the surgery workforce. And I'm sure this is pretty much similar everywhere else. Now, why do you like neurosurgery? I came across this tweet some days ago, and I'm sure some of you on Twitter might have seen it as well. There's no other specialty where you can help the lame to walk and the blind to see. And I believe that these are questions we all have to ask ourselves. Before you start the journey, you should be able to answer this question, because it's going to come up time and time again. Your teachers are going to ask you, your senior colleagues are going to ask you as well. At interviews, people are going to ask you, why? Why do you want to do neurosurgery? Is it just because it sounds fashionable? Why do you want to do it? Is it because of the challenge, the pressure charge situations? Is it because of the intricate microneurosurgery? Is it the love for patients, the love for anatomy? Is it because of research, the work ethic, pursuit of excellence, or being a part of the community? It's a rigorous undertaking, and you've got to think very carefully about why you're doing it. Many times when you're doing it, you're going to find out that, it's quite challenging. Why did I get to put myself here? I didn't realize that there could be complications. I didn't realize there could be this. But at the same time, there are many things that are awesome about this subspecialty. Get to know neurosurgeons. So I can remember when I first got to the UK and I didn't know anyone. It was the early days of Yahoo Mail, and I can remember emailing pretty much every UK neurosurgeon I found on the internet. And then the internet wasn't even as good as it was now. And I emailed everybody. And I think one or two got back to me. And they didn't really have anything good to tell me at the time. But I just persisted and still chased people up. So you should get as much information. And that's why I would respect everybody who's logged in today, is you've logged in because you want to know more about neurosurgery, because there's something deep in there that, is pretty much synonymous with some deep love for neurosurgery. You've got to be sure that it's the career that's right for you. So as a medical student, for the medical students out there, I know there are a couple of registrars here. You should at least spend some time in the neurosurgery service, no matter what your friends say, oh, it's busy, it's crazy, spend some time in there. Nowadays, there are a couple of places that have also got labs, not cadaveric labs, spend some time in there. Very soon there will be simulation labs, there's a lot, do some stuff that is neuroscience related and get a feel of it. Ask lots of questions. You can send messages to me, you can send message to any of the other senior people on this forum, ask questions. Now, for me, these were a couple of books. This is just a couple of books I started reading when I started off. And it's good to have an inkling. You could leave out, fine, this is a bit, you might not like this one. Some people might not like this one. I love it. But some of these books I can remember as a kid I read, like Gifted Hands. So I had books. This is Kid Black, who was a black surgeon in the UK as well. I mean, the US. So this is he is a Christian. I'm a Christian, and he was a neurosurgeon. So he talked about the big dilemma. So I read some of these books even before I started as a registrar, just because I didn't have so many people to tell me. I had maybe 2-3 mentors, but I thought it was better to be proactive and go out and learn more about it. Now, you might have seen this. This only came out this week, and this gives a picture of what is. So I think Gideon and is it Joseph, those guys in the UK, you probably need to know this very well. So these are part of the things that get assessed for trainees into neurosurgery. So most times you have the 7 domains that everybody looks at. You want at least to have a publication and presentation. And I was quite elated when Ulrich and Natalie were talking about presentations earlier, because you have to be a good communicator, get presentations. And I think us in Africa, we are very lucky, because it's to some other people where there's been a lot of research and paper fatigue. There's a lot that has not been investigated on the African continent, and it just means that there's so much potential for papers to come out of it. Clinical electives and neurosurgical attachments are quite important for people who have multiple degrees. Those are lucky. I did not at that time. Some people have diplomas. Show that you've got teaching experience. Teach your junior colleagues. Show that you've got a lot of teaching experience. And the good thing about teaching neuro is the more you teach, the more you tend to remember, the more you tend to know. When you teach people, you get more knowledgeable yourself. Psychomotor skills is important. That's a bit of a duplication. Anyway, never mind. Practical psychomotor skills. So you need to start practicing suturing, opening wounds, closing wounds. Skills are quite important. Nobody will be a good neurosurgeon if you did not have surgical or psychomotor skills. And leadership, lateral thinking. You've got to show. At the last when I got called to help with the surgical interview, I was impressed at how much surgical trainees were achieving. And at a medical student level, it's not too early. Get involved in organizational management, leadership, get involved. And then as a foundation doctor, you want to show that you're still learning, you're still amenable to learning, you're showing good evidence of career progression. Now, I put this picture here because it shows that this guy, Chidiebere, who you all know here, has skills that are different from the typical medical student skills. And you've got to show that. You've got to show people that you are not the average medical student, or you're not the average registrar. You've got other skills outside medicine. So how creative are you? I know someone who scored highly on his registrar application exams because he was very good in IT and he had done wonderful things in IT. I know someone who had done a lot in research. So know the competition ratios for neurosurgery. It's usually high everywhere, every country, every continent. Those are the 2 application systems for the UK, for the US. Get mentors and have at least 2 or 3 people who you can call on, who have known you, who know what you can do, and who can give references, personal statements, or letters of recommendation. A good knowledge base is very important. And then what happens when you apply this year and you do not get in? What are you going to do? Are you going to do another year of a research fellowship? Are you going to do a postgraduate degree? Are you going to spend some time in a cadaveric lab? Are you going to do an intercalated degree? Always have a backup plan that will still lead you to neurosurgery. Now, I always say the UK system is pretty much, we have, I think, the longest neurosurgical residency program in the world. It's 8, and that's even if you're lucky, if you get in on time, and if you get your consultant job on time as well. So when you finish your 2 years as a foundation doctor, you get in, the first 3 years of neurosurgery training is pretty much core neuroscience and initial neurosurgery training. This might involve rotations in accident and emergency, neurology, maybe even radiology sometimes, or other surgical specialties like orthopedics or general surgery and ENT. And then you have the remaining 5 years devoted to neurosurgery. This stage here is when you get your membership of the Royal College of Surgeon exams, and at the end is when you get your Fellowship of Royal College exams, which is one of, when I was training, I used to write them all out, which is one of 11 things that you have to bring to the committee to get your certificate of completion of training. In your last year, you should have at least start showing some kind of interest in what you're going to subspecialize in. Now, I know in many units in Africa, it's still not, we're still not big on specialty interests at the moment, but you can see that a lot of people are heading in that direction. And I think as the numbers grow, as we all join the neurosurgical workforce, there are going to be more subspecialty interests in Africa. Now, this is a bit of a complicated one, and I'll just leave this up just for you guys to look through. So it's pretty much the same thing. So you start off whatever degree you have. This is like a 1 year, just a 1 year in program. This is an old one, but it gives the same thing. So you leave medical school, you get in here. If you're lucky, you start to climb up the ladder. ALCP just means your yearly assessments. So every year you get assessed to see if you can progress onto the next stage. Sometimes some people will get told, oh, you need to stay back for another year or for another 6 months. Some people even get chucked out of the program if they feel that you're not, picking up as well as you should. And then you get here, and obviously this is not as fast as it is now. Usually you have to do some fellowships, and then you become a consultant. Now, I always feel that as neurosurgeons, you can do any other job in the world. And these are things that for your interviews and for your training process, you need to, as a neurosurgeon, you're well capable of doing. My first year as a registrar, one of the things I found really challenging was how quickly to think on my feet when referrals came in, especially when everybody else is fretting. You have an extra dural, or you have someone who's collapsed in accident and emergency, and nobody else is so sure of what to do, and they know, oh, it's got massive bleed, it's got fixed and dilated pupil. What are you going to do? We've got management and leadership skills, teamwork, communication skills, time management. These are the things we show on a day-to-day practice, and these are the things you have to show people that, listen, I can bring all these things to the table. This is why I need to be a neurosurgeon like you guys and be a part of the team. Now, we have something called the e-logbook. Anybody can actually set up an account with this website. It's called a Cradle to the Grave website, where every surgeon is supposed to log in and put in all their cases. And for anybody applying to the UK program, I was talking to some of my friends back in Nigeria the other day, and planning to have something like this as well for the neurosurgical trainees or the registrars. So the e-logbook, and you guys can all check it up, you pretty much put all your cases. And the reason why it's important is, as a baseline, before you can become a consultant, they will check that in the UK, you need to at least have about 1,200 procedures. In the States, I think it's 2,000 procedures. They have a website as well. I think it's the ABN website. So you log every procedures, and the procedures are classified to the ones you assisted in, to ones you trained somebody else, to the ones where you just observed, to the ones where you were supervised, but your boss was either in his office or just sitting down in theater just watching you, or where you were supervised with the boss being scrubbed. Because as you know, the different psychological levels to all these different things I've described. And then there's the ISCP, which has been ongoing now for about 10 years, which is where as trainees we log in all our data. So you have your audits, you have your case-based discussions, you have clinical evaluations. So every case you do, you're supposed to meet up with one of the bosses, and then you get assessed, and then it's logged on here. So when you go for your ARCP, which is your 6 monthly or annual assessments, they just look through it and they're able to see how well you're faring. So if you're scoring badly, they can just put it in and assess. Now, this is one that always amuses me. It's called a multi-source feedback, where for every rotation, you have to get feedback from everybody you're working with. So you have to get one from a consultant, another one from a fellow registrar, another one from a nurse, another one from a physiotherapist, and that highlights, how well of a team player you are. Research collaborations are quite important, and I was telling someone about AFAN the other week, and I said, I like how AFAN is doing stuff and being relevant nationally and internationally. And that's what you need to do. You need to make sure that it's a continuum. You continue with projects. There are a lot of things to do research on. Neurosurgical, neuroscience, things for the future. There are a lot of things that you can work on. Nancy, is like the UK equivalent, which is neurology and neurosurgery. When I was a registrar, I did a couple of projects with the BNTRC. The BNTRC is like the Neurosurgical Trainee Research Collaborative. So we pretty much did research across the country. And as we get bigger, and as everybody from here, from medical students, you become registrars, you can start to do things that are specialty specific or even multi-center studies. So at the moment, I have like a team which I've only just set up, but at least we've been doing some research as well. And it doesn't matter where you are. I've got people in the UK, I've got people, in Asia, and I collaborate, and we carry out projects, and we get them published. What next? So when you finish, one thing you should not forget is conferences and workshops. You always have to make sure that you go for that. And I know it can be quite challenging. Over the last 10 years, I've made this habit of any conference or workshop I go to, usually there are very few of us that are black there, and I just walk up to the few blacks I see and just make friends. It's just a habit I've got over the last 12 years or so. And I've met so many of the neurosurgeons like that. And I think conferences are quite good. I've had ideas for research, ideas for papers, from just going to conferences and listening to people speak. I spent 6 months in 2017, from January to June, with Ted Schwartz in New York. The reason why I got that fellowship was because I listened to him talk. I think it was at a skull-based conference sometime in 2012 or so. And I just walked up to him afterwards and said, I like what you do. You do a lot of minimally invasive skull-based. It's one of the things I want to add to my expertise, my neurosurgical expertise. Can I come and spend some time with you and learn from you? And he said, yeah. And he gave me his email, and I emailed him, and he gave me the slot. And because I was in training, I was a bit worried that if I went off during training, my bosses might be annoyed with me. I actually just kept things sweet for 4 years, emailed him regularly, and he kept the slot open for me. And I joined him in 2017. So sometimes, conferences or workshops are quite useful, and do not underestimate the power, the things that you gain from conferences and workshops. Try your best to fulfill the criteria, whatever country you are, whatever neurosurgical training program. For us, it's all about getting, courses in training, management, doing all the surgeries, making sure you've presented, being capable of doing big cases, and particularly the ones you're going to specialize in. So all those things you have to bring to the fore. You have to show at your last assessment before you get given the certificate of completion. Fellowships are increasingly important now. Everybody now pretty much has to do one fellowship or the other. And, and when you get it, then you get your job and you're able to lift the trophy, like the Cameroonian team here. I'm Nigerian, so these guys used to give us a lot of trouble. in the African Cup, but that's a story for another day. What are the specialty interests in neurosurgery? So there's skull base, which we all know, base of the skull. That's one of my subspecialties, as well as vascular. There's spine, there's trauma, and you can decide on, projects along these lines. There's functional, there's pediatrics, neuro-oncology, neurovascular, which you have to decide well as well now whether you start setting the template for interventional, because now there's a lot of intervention with neurovascular. So these are all the different things. I didn't add academic here. I didn't add hydrocephalus. I actually should have, because those are other subspecialties as well. And that pretty much brings me to the end of this. Contact details, you can contact me on that, and trust me, I'm very happy to be contacted. If you have any questions, I'm very happy to ask questions. If you need any help along neurosurgical lines, feel free to reach out. Thank you.
Wow. That was that was fantastic. That was fantastic. Oh my goodness. So first things first, I had someone reach out asking for your LinkedIn. So
oh yeah, that's just my name. Just type in my name. That's all. Andrew Alalade. I would just type it here. Just type. Yeah, just type my name and that's it. Okay. You can take the sharing powers back now, Ulrich.
Okay, thanks. Yeah. So if anyone has a question, you can type them in the chat section, or you can raise your hand. In the meantime, I'll ask a few generic questions and a few of the questions we received a lot earlier. So, Dr. Alalade, for a young African aspiring today for training, one of the questions we've had very often is, do I train on the continent or do I try and train outside the continent? And what would be your advice to someone today, and what should be taken into consideration when taking that decision?
It's a bit of a tough one, because there are a lot of factors. First of all, you think, where's your family? You've got to assess, where have you got family? Where have you got mentors? Okay, because mentors are quite important as well. Now, I'm biased towards Africa because I went to medical school in Africa, and I believe, there's a lot to be given to the African continent. But when I was in medical school, one thing that struck me was there were two of my very admired professors, and they weren't neurosurgeons, but they were in other specialties, and they were so good. They were so knowledgeable, and I was the class leader, so I was the one who used to organize lectures. And then one day I just did not find them anymore. I didn't know where they were, and someone said, "Oh, they've gone to the States." And that shook me a lot, because I was like, these are people I respect. These are top notch. They knew more than most people, and they left the continent to go and learn, some more. And with neurosurgery, I started reading books, and some things I only read in books, some things I only saw on the internet, and I just thought to myself that I want to be able to be a part of this. I would love to come back and help in some capacity, but it's all about kind of mixing it up. And now it's different, isn't it? Because now there's so many ways of getting access to things that are done everywhere else. But at that time, it wasn't as easy, and it depends, because even if you travel, you have to be sure that you're in a unit where you're going to be supported, because there's no point going to a unit where you will just be used and you're pretty much just there doing the jobs nobody else wants to do, and At the end of the training, you find out you're not as good as your colleagues who are back in Africa. So it takes a lot of planning. It takes a lot of investigative work. It doesn't really matter, wherever you go, just make sure you've got the best opportunities. I was talking to Claire the other day. I was talking to Iggy Esene the other day. There's Bev who's going to Kenya as well. So there are awesome people all over the continent. And what I know is so obvious now is I think the new generation will be a lot more proactive. So down the line in about 5 years, I know neurosurgery in Africa is just going to be unrecognizable. And it will be a good to keep that level of motivation.
Thank you very much. Fantastic, fantastic. And I think it goes back to what you said earlier, where you said you have to research, get as much information as you can. If you're trying to get into neurosurgery, spread your wings, reach out to people, and then the more information you have, the better it will be for you to take the easier it will be for you to take a decision. So one of the questions, from Dr. Natalie Gomsi, who was asking about time management, being able to deal with different things and equally dealing with burnouts.
Yeah, so and that's one of the things I mentioned, that when you're picking people to get into neurosurgery, you look at what they have done. So when I was in medical school, so in high school, I went to the high school is a military school, so it's attached to the Nigerian Army. It's called the Nigerian Military School, and it was a lot of discipline. It was really tough. But then I complained it was really tough. But now, throughout neurosurgery training, I was grateful for the training I had there. And then when I was in university, I was a member of probably the largest set that went to my medical school. We were over 400 students. And I was the leader for that set in my last 2 years. And it taught me a lot about time management. I learned to be very diplomatic with people. And I learned how to manage characters, from lecturers to fellow students, which is pretty much what I am still doing today. So I'm managing patients, I'm managing senior colleagues. Neurosurgeons can be very difficult characters to work with sometimes. It's a tough job, challenging situations. So somehow I just found out that the same things I've been doing for years, they're just coming to me again, day in, day out. With burnout, having a very supportive network has been helpful. I've been married now for over 12 years to a very lovely lady. She's been very supportive. So for many years where, you have, I can remember when I was in Nigeria, we used to have ward rounds as a house officer, ward rounds at 5:30. When I was in London, we used to have teachings at 7 o'clock, and I had to leave my house by 5:30 every morning for about 4 years. It was really difficult, but somehow I managed. I must say it got really tough, but having a good support network and sometimes just having other things outside neurosurgery to do and having people that hold you accountable, is also very good. So if Ulrich, gets into neurosurgery training and reaches out to me, I'm like, he's got to succeed. So he has to, he's got to call me every couple of months. Mr. Alalade, this is what I'm doing. This is what's going on. And I want him to succeed. So I'm going to be checking up on him as well. So you need someone like that, or people like that, which is why this group is quite important. Because people are going to be like, what's going on with you, Natalie? How are you faring at your job? So I've got like 2-3 registrars in the UK. They're black like me. We're not many. So they know me and they call me and I call them and I'm like, how are you getting on? So when it's tough, they will call me, Andrew, I'm struggling, I'm doing this, and we'll talk through stuff. And afterwards they'll be like, oh, thank you, you've been grateful. So things like that tend to help. We bounce off each other.
Thank you so much. I mean, that there, I don't think there's anything anything close to that. Before we get to Dr. Nuru's question, there's a question by Lorenzo Bopelo, who's a medical student from Botswana, and links to what you said about dealing with people. And her question is this: I wanted to know how you deal with with people around you who are not as motivated as you are or as you might be?
Yeah, I think you just have to look for other motivated people, and sometimes you might not get. That's just the truth. But there was one thing I learned when I was in medical school. If I was on my way out of medical school, and I visited a friend, and she told me about her younger brother who, in his university, had been told to write up a 5-year plan. So I wrote up my 5-year plan. So I said, I want to be able to get into residency in the UK. I want to do the MRCS exam. I want to get a master's. I want to do this. I want to do that. Now, some of those things I did not achieve. I'm not going to lie. But having a plan helped me to at least achieve like 70%. So every couple of years, I rewrite another plan. So I rewrite another plan, I save it somewhere on my desktop, and I walk towards it. In fact, I was going to put a slide up, but because it's an old one, that's why I removed it. So like even for conferences, if you go to my office, on my office wall, I have a list of skull-base and vascular conferences over the next 1 year. So sometimes I just say, you know what, I want to have a presentation. I will probably need a registrar or a medical student who's going to present for my team in that conference. So I'll aim for it. So it's like planning. Now, nobody's going to tell you all that because many of us were just going with the flow. And that's why you need to be part of a community. And that's why, like now, Lorraine, if you have people who do not understand your passion, I understand your passion. In AFAN, we understand your passion. So you've got to stick more to us than to the people who do not understand your passion.
Wow, 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 wow. That is fantastic. Okay, so yes, the next question here is from Darwin. Yes, so Darwin's question is about interview tips. For neurosurgery interview, do you have resources? And the next one is, how do you build practical and psychomotor skills?
That's easy. So you could go into the hospital, tell them to give you, the suturing materials or things that have not, maybe the ones that are spoiled that they've discarded, clean them up, get them cleaned up, practice, get a couple of other colleagues like yourself, and even practice some more. For hospitals that have like cadaveric labs or morgues, I don't know how, depending on what hospital you're working in, you can spend some time as well, learn stuff, some anatomy. But for me, when I started, different techniques of suturing, right-handed, left-handed, ways of knotting. I just took stuff, went home and practiced and practiced. In the UK, we have some courses called Basic Surgical Skills and Foundation Skills, which also help you. You sign up for those courses, you go for them, they help you with all your, testing things. And then as I started to go higher in my career, when I got to the stage where I was beginning to use a microscope, it was a bit of a struggle the first 6 months or so. Using the microscope was a totally different skill. So I had to go later when nobody was using the microscope in theater, use the microscope, practice with it, because it's totally different. Operating under the microscope is totally different from, just open surgery without a microscope. So those are the things you need to do. So I would say, I don't know what stage you are, Darwin, but if you're still at medical student level stage, then, go to the hospital, get a forceps, needle holder, take it home, get some sutures, and practice and practice and practice. Practice on anything, on a banana, on anything, just make something out. And now you can check on Google. There are different ways on Google where you can check things as well. And you find out that you're even a finer surgeon than everybody expects you to be by the time you start.
Thank you. Thank you. Yes. So the next question here is from David Amabara, who's it's around mentorship. So his question is for medical students, how do you get into that mentorship? And I will add to that, what would you say for you is the what is the ideal mentee and what should a mentee look for in a mentor?
Yeah, so the ideal mentee is The ideal mentee is someone who is willing to learn. And that's pretty much it. You want to be good and you want to end up being better than your mentor. Now, you don't necessarily have to tell your mentor that, because some mentors might not like to hear that. But I, as a mentor, would never, feel bad if my mentee wants to be better than me. The whole aim is for everybody here junior to me to be better. So it's all about learning. And mentorship can be like, there's certain exams that I think are very easy to pass. And as long as you know the right technique. Now, someone who is not as, you have two individuals, one is very intelligent, the other one is not so intelligent, but because the one who's not so intelligent has got a good mentor who has told him or her the right structured way of answering questions, you find out that this person will pass the very difficult exam. And that's what happens, because mentoring makes all the difference, because literally what you're doing is you are going through the same path, but the road is made much easier for you. So seek out a mentor. And I'll tell you this, in my early days when I didn't have a mentor, I just read up stories about people. And that's why I read a lot of biographies. And you see my book collection, they were just biographies of people, because I felt that I did not have a live mentor. All I could do was to read their stories and try and deduce out things for myself. And it's way difficult. But now you've got people like me around, you've got more people around, and we're willing to tell you and lead you in the right way. And always remember that even if you hear Andrew or Nuruddin or who else is senior here, or you got Aminata, talk, their stories don't necessarily have to be the same as yours. Your job is to pick out the good things that are applicable to you, because we can't all be the same. You just have to pick the things out. As a registrar in the UK, I did some research, and I was going to do a PhD. I wanted to take some time, but I had my kids. I couldn't afford it. So I said, okay, I got a post, but I couldn't get funding. And I said, I've got a family to feed, so I can't go on my PhD. But when I went for my fellowship and I worked with an American neurosurgeon who was very good on research, just working with him, I learned so much. He doesn't even know it, but I spent time with it and I just learned so much. And all of a sudden, just writing papers became so easy to me. Like, for years, I always dreaded writing papers. I always thought writing papers was so difficult. But just after working with him, I just realized that my colleagues who were writing a lot of papers, and I looked at them as being high up, it wasn't that difficult, because now I'd seen it done by someone who did it on a regular basis. So that's what you need to do. You move with someone who does it on a regular basis, and it rubs off on you.
Thank you so much. Thank you. And again, to what Dr. Alalade just said, we've said it here, and we've shared a lot of those books, biographies, sometimes autobiographies, even in the WhatsApp group. Please read them and make the most of them. Thank you so much. So the next one here is Ndale Genevieve, a medical student from Cameroon, and her question is about subspecialty and choosing a subspecialty. So it's around how do you come about deciding this is the subspecialty I want to go into?
So for me, so neurosurgery, making up my mind about neurosurgery was always easy, because I'd always wanted to be a neurosurgeon since I was a teenager. But for subspecialty, it's not an easy one, and you shouldn't make the decision very early. You should make a decision after you've done all the subspecialties and had general training. And then you start to find out which ones am I better at? Which ones do I enjoy? Like skull-based, the skills for skull-based are totally different from the skills for functional, totally different from the skills for spine, you know, even the communication. Like when I had my kids, I just found it very difficult when relating with parents of kids for pediatrics, because you're not just treating the patients, you're treating the parents, and you're treating very anxious parents. So somehow I just found that because when I have a kid with a tumor, I get really anxious. I'm like, oh, you know, I've got kids at home, I don't want this. So I managed it in a totally different way. And I just found that, you know, with pediatrics, I wasn't enjoying it as much as when I go in, you know, do a score-based case, difficult. I don't mind staying long hours in surgery, you know, teasing things very delicately off the nerves. People are complaining that, oh, you're spending 10, 12 hours. I didn't mind that. For some other people, I know colleagues who would do other specialties that would not involve a lot of hours in theater. So they just want to do something short, sweet, fast. I didn't mind that. I don't mind doing really long cases. So you have to think about what you want to do. And some, you know, specialties can have even more higher complications. You know, are you happy to deal with that? Are you happy to deal with the families afterwards and say, you know what, there was this complication, or this is difficult, this surgery, these are the associated side effects. So always try and take it to, you know, either the middle or end of your training before you decide. Is it advisable to choose one? I would think yes. Sometime in 2013, I was at a national conference where a lot of neurosurgeons were not happy. This was in the UK. We weren't really happy that, you know, there was this argument, general versus specialty. But then we did a kind of closed survey where everybody had devices and we had to vote. And you find out that even neurosurgeons, if you get asked and someone says, oh, if your daughter has a skull-based tumor, who would you rather go to? Most people will still choose someone who's a subspecialist than someone who is a general, you know? So somehow the world is going in that direction. And even in Africa, I know a lot of neurosurgeons who are now beginning to subspecialize. I agree that a lot of people, you still have to be very good generally, you know, and that's one thing I respect with a lot of colleagues in Africa, because there's a good wide array. But at the same time, when you do something and you're kind of a specialist in it, it kind of means you've focused on that and you are able to handle everything regarding that.
Wow. Thank you so much. Because we're on the hour mark now, we'll just say officially goodbye to this. And depending on how much time you have, we can have some other questions, because I have a lot of people telling me they want to ask more questions.
Yeah, that's fine. That's fine. You can go on.
Okay.
I'm happy. It's okay.
Awesome. So the first person wanted to ask a question, Dr. Tetino, go ahead. You need to unmute, yes.
Oh, okay. Can you hear me?
Yes, we can.
Yeah, I can hear you, Franklin. Yeah.
Okay, good evening, everyone. Nice to meet you guys. It's a real pleasure to meet you, Dr. Alalade.
Yeah,
Dr.
thank
Nuro
you.
once more. So I came late for the presentation, so I just missed your presentation I just came when you had finished your presentation. My questions is just that what is can you summarize your journey during medical school? After medical school, you go to the UK and enter into the residency program of neurosurgery. I would just want a summary of your journey, and even a research experience that you get during your journey.
Okay, that's cool. That's a very easy question. You got 2 minutes, yeah? It's a long one. So after medical school, so I've always wanted to be a neurosurgeon. So just like a lot of people on this forum, even before medical school. So I'd always written it. I want to be a neurosurgeon. So when I was in medical school, I started focusing a bit more on neuro, you know, and even as a medical student, I would go out, spend some time in the brain cut-up lab. So we had this, like the mortuary where the pathologists used to do stuff. And every Monday, we used to have neuro sessions. So I used to go, if I'm free, I would join the, it used to be neurosurgeons, neurologists, and neuropathologists. So they would sit down and I used to answer questions, you know, I started getting to know things about the brain. And then I finished from medical school and I did my house job. And house job, you had to rotate through surgery, medicine, O&G, and pediatrics. So when I was in medicine, I was so lucky, I got put in neurology. So that helped me, you know. And then when I was in surgery, you had to rotate to 3 units, but I asked specifically that I wanted to do neurosurgery. A lot of people used to run away from neurosurgery because neurosurgery, we had to do ward rounds 5:30 in the morning, but I didn't mind. So they actually told me to swap with someone else. So I swapped into neurosurgery. So that helped. And then I came to the UK and then I started doing the exams. So I started in what they call like a senior house officer role for foundation year 2 in Glasgow. Did neurosurgery and some other rotations. And then I became even a senior house officer. I did some other surgical rotations, including orthopedics. And then first year as a registrar was in Leeds, and that was about 2009. And I wanted to get into training because the thing in the UK is it's quite difficult to get into training, and especially when you're coming from outside. But the good thing about the UK is the UK, there are a lot of fellowships, there's a lot of space for people to work, but to get into training itself can be quite challenging. So I applied that year, and luckily I got in, and it was so good for me because there were only about 9 jobs in the country at the time. So I got into the 3rd year. At the time, they used to take people 1st year, 2nd year, 3rd year. So I go into 3rd year and I was completely blown away because I wasn't expecting it. So I go into 3rd year and then I trained in London. So 3rd year up to 8th year. So I finished that. And when I was in Queen Square, I passed my exams in 2015, my fellowship, FRCS. And I got chosen as chief registrar at the time, which was really good, which was quite impressive. I didn't think I would be chosen to do that. And then I finished there. And then when I finished my training, I did an extra 6 months in Queen Square, and then went for my fellowship in New York for 6 months. And that's where I did a lot of research. That's why I started to get more research. So I'd done some research before, but when I was there, it got me even more knowledgeable along research lines. And then I went to Australia because in Australia, I wanted a place where I'll be able to operate a lot more. And the unit had been told by a senior colleague, some professor, that if you go there, if you get the fellowship, you would, get to operate a lot more. I actually applied to so many places. I applied to even Canada and some top units in the UK. But I didn't get the ones in the UK. I didn't get the Canadian fellowship, but I got the Australian one. So I went there. And then when I finished, I was hoping to come back straight into a consultant job. But in the UK, there were very few consultant jobs. So when I was in Australia, when I had 3 more months to go, they emailed us and said, listen, there are 43 of you in the country who have finished your training and are waiting for consultant jobs. So 43. And I was like, wow, quite a lot. So I came back, interviewed for several jobs. I didn't get a consultant job. I'm sure I interviewed for about 10 consultant jobs. But then I ended up staying in Liverpool for a year. So I did a fellowship in Liverpool again, which was skull-based. When I was in Australia, I'd done skull-based with vascular. And then I got my consultant job. And I've been doing that for the last year or so now. So that's pretty much the story of my medical neurosurgical training, Franklin.
Wonderful. That's very interesting. Okay, thank you.
Thanks.
I hope that this will encourage more people in the AFAN to continue to fight about that dream that all of us want to achieve.
Yes, yeah, absolutely.
Let's get the last one for today. Dr. Gomsi, Natalie, you have a question?
Hello, doctor. Let me show my face this time. So,
Hey, Natalie, good to see your face. This is what you look like.
yeah, actually, yeah, with the African behind this is Dr. Aminata who taught me this one. So I just wanted, my question is a selfish one. Please, doctor, would you mind being a member of AFAN? So I'm advocating
Oh, I
for
thought I'm already a member, isn't it, Ulrich? I thought I'm a member already.
There's a WhatsApp member. Yeah, you're a member, but we wish to take your permission to include into the WhatsApp group, maybe, so that you can have much more.
Definitely.
Okay, thank you. This was my selfish
No
question.
problem at all.
Well, thank you so much. Thank you so much, Dr. Alalade. I mean, it is obvious.
Absolutely.
It is obvious from the questions, the interest that people absolutely love this session. We have someone who asked about having your PowerPoint slides, maybe to go through them again once more.
Yeah, definitely.
Okay, thank you so much. We're going to, as customary, if you missed the beginning of the presentation or any part of the presentation, you'll find it on YouTube. We'll share the links as soon as we've uploaded it. So feel free about that. And Dr. Alalade shared his contact details, so you can definitely reach out to him. And if you have any further questions, please go ahead. I'll stop the recording now, just so that